Good morning, everyone. I'm Jeff Tonello, and I'd like to welcome all of you for our little video chat here. Been asked to kind of update us as a church body on the COVID-19 virus that is certainly evident over the past several weeks here in the United States and around the world. The decisions behind why we are not gathering on this Sunday morning as we traditionally do, and the reasons why over the next couple of weeks we feel it important not to, based upon some good data and medical recommendations. Certainly we can learn a lot from what's happened in China and Italy and other countries around the world. The thing that's probably most evident is that the virus, with its rapid rise in those areas, has overwhelmed the healthcare community and limiting the ability to meet the emergent needs for a lot of the individuals that are more sick than others that are healthy. Whether it be through manpower, supplies, things such as that, that's what's caused the strain on those healthcare systems. Many are familiar with what is called the bell curve, and the bell curve certainly has a beginning, a peak where it rises, and then a descension on the other side of it. And that rapid rise in those countries has caused that overload of their healthcare systems and led to many deaths because of that. And certainly here in the States, the medical community is looking to minimize that curve. And the term that is being used quite readily now is called the flattening of that curve. And what do they mean by flattening of the curve? So they feel that if we as individuals can not meet in large groups, not have a lot of social contact, can minimize or mitigate the spreading of that virus here in the United States. Not that we're going to completely stop it, but we want to minimize it so that we don't have that rapid rise of that bell curve and have our own system overwhelmed, because our system can certainly get overwhelmed if there is a severe outbreak of this virus here in the United States. So the importance, obviously, is that we adhere to the advice of those that are experts in the field of infectious disease. We certainly here at the hospital are taking extreme measures, obviously, to prepare for the what if, and hopefully the what if doesn't come to fruition. So as we, over the next few weeks, gather, just certainly keep our hearts soft, our minds and open to what God may be saying through this time. It's an opportunity, obviously, to be able to minister and be a blessing to others. As Romans 12:10 does say that, we want to prefer one another. And I think by us meeting as we are in this, somewhat unconventional way, is preferring others, especially those who are elderly, who are more susceptible, those who have some other what's called comorbidities or medical situations that would predispose them to being more readily able to get this virus in a more violent way than those that are other individuals who are young and healthy. So again, I think that's probably the main point of all this, is that we would not want to risk others, certainly, with this virus, and again, being able to prevent this from being rapidly spread here in the States. And certainly, prayer is the most important thing, because God is the one who is sovereign and in control of all things. And we want to remain soft in our hearts to what He is saying to each and every one of us. God bless you, and we'll be seeing you at TNT on a Sunday morning in the very near future. Amen.